Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, we'll detail how to identify and derail depression in seniors. Then, we'll drive home the keys to deciding if it's time for mom and dad to put their car in park. We'll share tricks on how to properly treat your teeth. And, is your spouse cheating on you?
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. I'm sure we've all battled the blues now and then, but depression is different. And as we age, there can be a rise in the risk of developing this often debilitating disorder. Dr. Eric Burko is here to prescribe a path to avoid this illness as well as to defeat it. Dr. Burko is a clinical psychologist with Metro Health. Welcome to the show.
Thank you for having me.
Well, how can getting older cause depression?
Well, it's certainly understandable. A lot of people think it's inevitable that as you get older you're going to get depressed, and I'm here to say that's not the case.
Well, that's good.
Yeah, well, you don't have to get depressed as you get older. Now, if you think about it, each one of the stages of our life, we go through a transition, right? And we kind of ask ourselves some questions. Who am I? Why am I here? And we're trying to understand how we fit in. So it's understandable as we age, we can change. Our physical body may change, our physical appearance may change. A lot of people spend a lot of money on trying to preserve their physical appearance in one way or another. Our social world may change. People that we care for may no longer be with us. Our financial world may change. We may be living on more of a limited income, and we're not used to that. So it's understandable with all those changes and all those stressors how someone can begin to feel down or depressed or hopeless about things.
Yeah, I mean, they're losses, really. So the losses are kind of inevitable for most people. So what do we do to avoid falling into this depressed state?
Yeah, prevention is a really great question. We'd really like to prevent things if we can. The first thing to do is really to get a good medical checkup. There are a lot of medical problems that can kind of look like depression. So you need to have someone look over your medications to see if there's any side effects, to see if there's any medication interactions. You want your physician to check things like your thyroid and your blood pressure and your blood sugar. So get a good medical checkup first to make sure that there's nothing wrong. But the number one prevention, if I asked you, what do you do if you're feeling sad or down? What's the thing that you would do?
You call your friend.
You would call a friend. Social support is the number one thing that protects us as we age. So keep yourself social, get involved, stay actively involved with the people that you love and that are around you.
Yeah, a lot of the clients that I meet with, the ones who are really out there doing things, do seem to be better. So
yeah, they're doing things like continuing education or getting involved in church or other social activities. It's good for you.
So what else can we do?
Well, I think I would get fired if I didn't talk about exercise and nutrition.
Of course.
Right? I have to talk about those things.
It's required.
The truth is, the reason everyone harps on it is even for our emotional well-being. If we keep our body active, if we stretch our body, if we practice our balance, if we keep our muscles strong, we do things like preventing illness and we do things like preventing falls. And if you think about once you fall and you have to have surgery or you're limited or you needed extended care, that can be very depressing and change your life significantly. So you really want to keep your body going. And you also want to make sure that you're putting good fuel in your system. And we need to be careful. A lot of people don't think about as we get older, sometimes when we're not feeling well, we start kind of medicating ourselves. So maybe we're drinking a little bit more, or we're kind of using caffeine as a stimulant, or maybe we're taking a little bit more of our anxiety medicine or some of our other medications to kind of treat ourselves. So we need to be careful about what we're putting in our bodies.
Okay, so now adult children, we're getting into the holiday time, maybe coming home to see parents. They may not recognize that there's things like this going on. What are some of the symptoms for them to look for?
Yeah, it's such a great question because we don't know and we get nervous, right? We come home in the holidays and we see mom and maybe you're out of town. Oh my gosh, I can't believe what's going on with her. So those symptoms you want to look for are this loss of interest in pleasure in previously enjoyed activities, Someone may be feeling down or depressed or hopeless. There's a major change maybe in your appetite or your sleep. Decreased hygiene. You'll see mom's just not really kind of taking care of herself the way that she used to. There's often this resistance to going out. You know, no, there's a million reasons why they don't want to go to the birthday party or the grandchild's event. Anger. Sometimes depression sort of has teeth, and we get angry at others. And sometimes you'll see a change in personality.
Okay. Great information for us today. Depression can make life seem very dark. Be aware of the signs and follow Dr. Burko's tips to turn on the light of hope. Need more help? Use the information that's coming up next. My thanks to Dr. Burko for joining us today.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, putting parents in the passenger seat. But first, would you believe that the television show Get Smart was actually inspired by a cunning combination of James Bond and Inspector Clouseau? But unlike those agents, Maxwell Smart needed a career cover for his spy specialty. What occupation did 86 offer? We'll be on the job with the answer when we return.
My husband and I got into the car and we couldn't do it. We couldn't pick one baby over the other. Coming to Metro changed the entire pregnancy. We actually started to become happy with our situation. We owe a big thank you to Metro. I can't imagine our family without Sam.
If you answered that 86 was an insurance agent, you missed it by that much. While Maxwell Smart occasionally copped to that cover, his preferred pretend profession was a greeting card salesman.
Are you worried your parents' driving is becoming dangerous? Communicating that concern, coupled with capturing their keys, can cause a family feud. Max Gerwell is here to alert us to the warning signs and also to share tips for ending driving with dignity. Matt is a retired state trooper and CEO of Keeping Us Safe. So we're going to talk about that. Now, I think we know kind of the physical signs to look for, you know, eyesight, physical ability, hearing, reaction times. But you say there's another really important sign to look for. What is that?
There is. Oftentimes we underestimate the importance that memory plays in driving and in safe driving. There was, in 2011, January of 2011, the headline of the Washington Post read, "Elderly couple found frozen to death after getting lost on drive." And what happened was they did just that. They were driving on a familiar route, so it was a trip that, to a relative's house that they had made countless times before and got lost this particular time, and like the title suggests, it ended up being their demise. So memory is so often overlooked. We concentrate on vision and hearing and strength and flexibility and reaction time, which are obviously all extremely important to driving, but we can't overlook the memory issue as well.
So, because they're worried about getting unlost, right?
They're getting worried about getting
not
unlost.
Paying attention to the driving.
They don't pay attention. Not only that, they completely fall apart. I've ridden with so many older drivers that, as part of our self-assessment program, that have gotten themselves lost on a route that they're familiar with. When we go out and do the driving exercise of this self-assessment program, we take them to locations that they're familiar with. In fact, the 3 locations that they're most familiar with, so that they're comfortable with that, and you know, kind of put them in their best possible environment. But they become lost, and when they do, they completely fall apart, Lori. An older driver, or probably any of us that's lost, will tend to look backwards to see what street sign they might have just missed. And when they do that, you know, we've all reached into the back seat for something, and you find yourself drifting left to center, and they do, and they come completely unaware of those hazards that they're actually becoming.
Yeah, I see why that's really important. So all these reasons we have for having this conversation, getting your parents to stop driving, but how do you start that conversation with your parents?
It's a touchy subject, isn't it? The unique thing about this this whole issue is every family handles it in a completely different manner than the next. So there's no cookie cutter model, so to speak. My best advice is to start those conversations today, regardless of where your parent is in that safe driving continuum. They might be the best driver on the road, but start those conversations today so that if and when the day ever does come that it's time to escalate them, then you're comfortable with that, and those doors have been open to such a conversation.
Now, you talked about an assessment that you do. What's that about?
It's a self-assessment. We sit down with the older driver, typically on behalf of concerned family members or a physician, and go through a 3-hour tabletop, we call it, we conducted it in the home of the older driver right at their very kitchen table. So it would be you and I. We would go through a whole litany of tabletop, pen and paper, cognitive type exercises, and then we would actually go out and perform a driving exercise as well.
That's what you were talking about, yeah.
Assuming it's safe to do so. Yeah, that's what I was referring to earlier. And then we help the older driver make decisions, his or herself, about
So you don't
their
tell them
driving.
whether they passed or failed?
No, there really is no pass or fail. We like to use the term the individual is or is not at an elevated risk for a future traffic accident. And then we try to guide them appropriately
And
from
you've got a
there.
booklet for people?
We also have a workbook titled Beyond Driving with Dignity, the workbook for the families of older drivers and their families. It's a working workbook. If we were to flip through the pages, you would see that it's full of exercises and fill in the blanks type things, so it requires some work. But what it's designed to do is remove the family's opinion, emotion, and speculation from the process.
Just
And
the facts.
Just the facts, and reduces everything to facts, just like you said, and then helps them make appropriate decisions from that point forward.
Sounds like a great program.
Thank you.
Putting your driving life permanently in park is a difficult decision, but you can help your parents on this rough road. For their safety and for others, order the workbook from Keeping Us Safe, or give them a call to arrange a personal visit. My thanks to Matt for joining us today.
Thank you, Lori.
Find out more about Keeping Us Safe by calling 877-907-8841 or log on to www.keepingussafe.org. Next, do you have sweet teeth? Looking for places to go, things to do? Welcome to our community calendar. Planning for retirement isn't what it used to be. To learn how to prepare for this new phase of life in a new way, plan to attend a complimentary seminar presented by the Lineweaver Financial Group. The event will take place Tuesday, October 14th at 1 p.m. and again Thursday, October 16th at 6:30 p.m. at the Lineweaver offices in Valley View. To reserve your seat, call 1-888-313-4009, and to find out more, visit their website, www.lineweaver.net.
Halloween is just a few weeks away, and while we may no longer go door to door begging for candy, it seems we're never quite too old to treat ourselves to some sweet samples. The trick is they're terrible for our teeth. Dentist Steve Marsh is here with some frightening facts about dental decay, along with ways to ward it off.
Hi, Lori. Nice to be here.
Nice to have you back.
Thank you.
Always. So, this is your annual discussion about tooth decay. So, how do these treats make tricks on our teeth?
So I'm just going to tell you the basic thing is that when you have sweets and you have bacteria in our mouths, the bacteria breaks down the sweets, it produces an acid, and the acid then attacks the tooth and causes tooth decay. And I feel very fortunate to be able to bring this to the community, because I can tell you that we are in a huge upswing of decay.
Really?
I practiced for now 37 years, and I can tell you in the 80s and 90s we sort of got rid of it with fluoridated water. Well, today we don't drink as much fluoridated water, and we're just seeing this huge upsurge in decay.
So, it's not just for the children, it's for the parents and grandparents too, right?
Well, that's what's happening. We have kids who, again, don't drink bottled water, or they do drink bottled water without fluoride. They have all these things like gummy bears and Starburst, which taste wonderful, but they stick to the teeth, and
Right.
it brings the sugar in more.
I like gummy bears too.
Yeah, so that's how it affects kids. So if you want to treat and you go to Halloween, that's fine, but brush your teeth immediately afterward. We have people older people want dark chocolate. They heard it was good for them, so
I've heard that.
So they suck on dark chocolate, they chew it, and that causes more and more problems.
Okay, it's just the sugar just sitting in your mouth.
Absolutely.
Okay, so my guess is we have to cut back on sweets sweets, we have to focus on cleaning and flossing and all the good things we're supposed to be doing.
Well, we do that. And one of the things that happens, let me point this out, as we mature, as we age, a lot of times we lose saliva where our mouths are drier. It happens from people who have diabetes. It can be from blood pressure medicine. All those things dry the mouth. Well, saliva not only cleans the teeth as you're eating and helps move the food back in our mouths, but it also buffers that acid. So the drier our mouths, the more our roots are exposed because of gum recession as we get older, the greater the chances of tooth decay.
Okay, but you've got some solutions?
Well, let me just very briefly mention there are a number of things. One's called biotin. It's like an artificial saliva that people use. We ask our patients who've gotten a little older to use Prevident 5000. This is a toothpaste that's prescription strength. It's very, very strong with a high amount of fluoride. That helps. We also have something, and you can taste this, Lori. This is actually a xylitol tablet. It's one of the things that you can use to bring the saliva into the mouth. Now, one of the problems is a lot of people...
Doesn't taste bad.
That tastes great, but when people have dry mouths, they suck on lozenges, hard candy, to bring the saliva in. Well, that just adds more and more sugars to the teeth. And lastly, if you have somebody in a nursing home, one of the other issues is it's hard for them to brush, and the caretakers have a lot of things. So oftentimes we just say get a $5 spin brush, and that will help clean the teeth as well.
Okay, so, but what's the treatment if the treats have already tricked our teeth?
Well, and we have some pictures to show how we do treat them. Again, prevention, like everything else, is important. This is a young woman, Lori, 19 years old, very thin, watches her weight, eats a lot of candy. There's no fat in candy, bathed her mouth in sugars and literally rotted that tooth off. We were able to build it up. It had to have a root canal, a post, so we can get a good result, but the key, again, is prevention.
Right.
A young man, and he was actually a golf pro, 28 years old. He literally drank Gatorade, another problem, not to badmouth Gatorade, but these sugary drinks that they use for sports will oftentimes bathe their teeth. We have the same thing with cross-country runners. So literally it decalcified and brought all that area into decay. An interesting problem. This is a woman in her 60s. She took care of everybody else in her family and let her mouth go. This is how she came to us, and we were able to restore it with porcelain veneers and crowns, but it took a lot of work and a lot of dedication to bring her to that. So the answer is yes, we can fix it, but we really want to concentrate on in prevention.
Good advice. By carving out just a small space for candy and caring for your teeth, you can treat yourself to a sweet smile. And if you need more help, Steve has a few treatment tricks to restore your smile. Give him a call. His number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. It's time to get up and go, an exercise minute on golden opportunities.
Hello everybody, it's Mike Carbon from Breakout Fitness, and we're here today to show you how to strengthen that core and the ever important abdominal muscles. You ready to go?
Let's flatten those out.
Let's do it. All right. We're going to do a basic crunch today. We're going to start lying flat on the ground. We want our feet flat as well, with our legs bent at about a 45-degree angle. From here you have two options. Either place your hands above your eyes, or you can give yourself a hug and cross your chest. All we're going to do is keep your chin pointed towards the ceiling, squeeze the abdominals, and bring your shoulder blades off the ground. We're looking for 15 to actually 20 repetitions here. All right, how you feeling, Lori?
Oh.
Keep them coming, come on. We need at least 3 to 4.
I can do it.
You got it, all right. We need at least 3 to 4 sets of these. Remember, slow and controlled movements, and you got to remember to breathe. Do not hold your breath. You're looking good. 6-pack's on the way. All right, everybody, now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
Life can take us down many paths. Perhaps you've married, raised kids, changed jobs, and you've always figured out a way to get where you need to go. But now you've hit an obstacle that may just stop you in your tracks, deciding on the best care for your aging parents. Rochelle Kozich is here with help. Rochelle is the Director of Marketing for the Senior Comfort Guide. So welcome to the show.
Thank you for having me, Lori.
With so many adult children, deciding on care for their folks is just overwhelming. You know, when the parent turns into the child again, you got to take care of that. And they have so many questions. I mean, where do you even begin?
Oh, believe me, you need to be educated. The bottom line is to know what you're looking for, know what you need, and go out there and kind of search. The best search method, though, has become the Senior Comfort Guide, where we have developed a lot of information that tells individuals where to look, who to turn to when this happens.
Okay, so knowledge is power. That's what they always say. So people need education, they need information, they need options. So let's talk about it a little bit. So, and this, I'm assuming, can all be found in the Comfort Guide. So let's take them one at a time. So let's talk first about education. Tell us some of the words that the children are going to encounter.
They're going to look for things like, what is home care? What's provided when home care needs come up? Finding out the differences between what non-medical home care is and skilled medical care. That means an individual who may be able to provide you with home care where you're not able to take care of yourself, but also what about that individual who needs to have their medications monitored, to have their blood pressures checked? That's skilled home care. Then there's assisted living. How do you know that you need assisted living? What does assisted living really mean? Does that provide you with an opportunity to have somebody there for you to help and basically assist you with your daily living? And those facilities are available.
Okay, so options is one thing. So you're talking about facilities. So there's lists in here of types of facilities, assisted living,
Correct.
home agencies, nursing homes, in the worst case scenario. So what do we need to consider? What are the questions to ask to determine which option is really right?
Well, basically, when you are looking to find where to go and what type of services you need, the direction from some professional to help you, a social worker, a person who works with the elderly on a regular basis would be able to give that type of information over. Your doctor, your clergy, but then again, the people at the Senior Comfort Guide are able to also help direct you.
So where do we find them?
You can find these guides at all the major hospitals throughout Northeast Ohio. Now, the case managers, discharge planners, and administration will use the guide when they're working with the family or the actual senior. You can find these also in all of your senior centers, and if they're not at the senior centers, it's probably because they ran out of them and they need more. Okay. So if they're not there, ask for them, and your local libraries too.
All right, great information. The Senior Comfort Guide is a revealing resource for senior living and care options. To find out more, call 216-292-8485 or log on to their website, seniorcomfortguide.com. My thanks to Rochelle for joining us today.
Next, how to protect your finances from your spouse.
Hilltop Village Apartments is retirement living at its best. Residents enjoy a wide variety of activities and living services with all large first-floor apartments, private screened-in patios with beautiful park views, daily dining room meals, free laundry facilities, 24-hour staff, and so much more. Enjoy safe, comfortable independence at a very affordable price. Call today for a tour and learn how you can get your first month's rent free. Hilltop Village Apartments, retirement living at its best.
Is your spouse cheating on you? No, I don't mean it like that. What I'm asking is your spouse cheating on you financially? Does he spend money or run up debt without telling you? Has she set up a secret bank account? Lots of folks, one poll says, 1 in 3 do hide financial things from a spouse. So how can you find out if your spouse is cheating, and how can you protect yourself? Here with his usual good advice, which is he's not hiding from us at all, is my partner, Mike Solomon.
Hello, Lori.
Hello. So I know in your practice you've seen spouses that have actually done this, right?
Well, yes, once in a while that happens, and many times no one knows about it, but when it comes out, it can really damage a marriage when all of a sudden that happens.
What's the warning signs?
Well, there are many. I'll give you 3 common ones. One, maybe the spouse refuses to talk about money, and if you ask, they just won't discuss it, or the spouse demands complete control of the finances and won't let you look at them. Or maybe you're looking around the house, all of a sudden you find a little bunch of cash just sitting there, or withdrawals are coming from your accounts, you're unaware of why that happens. Those are all different signs that something's happening.
Okay, so how do we protect ourselves?
Well, there are a number of tools you can use in estate planning or financial planning to protect your assets. One, a very basic one, just set up a joint account that requires both of your signatures to withdraw any money. Now that can be very cumbersome because every time you need 2 signatures. So you might have a smaller account, a regular checking account, let's say, with either of you can write checks on or access, so you protected most of your money and some of it is a little bit more at risk.
Okay, any other protective tools?
You can do a specialized trust to protect your assets so that this doesn't happen, especially in a second marriage. You might want to provide something so that you can share the assets in the second marriage, but on the death of one of you, the assets are protected so the surviving spouse doesn't spend it all or give it to her kids rather than your kids.
All right, great advice. Hopefully you and your spouse deal honestly and openly with your joint finances. But if you have any doubts, take Mike's advice and protect yourself. For more information, come on out to a free estate planning and protection seminar taking place October 13th at 2 p.m. in our Beechwood Law Office, or 7 p.m. that night at the Holiday Inn Cleveland South in Independence. You could also choose Wednesday, October 15th at 2 o'clock at the Middleburg Heights Community Center, or that evening at 7 at the Westlake Recreation Center. To reserve your spot, use the phone number that's coming up next.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.bssplaw.com.
Thanks for joining us. On next week's show, we'll unwrap the reasons for the rise in our wrinkles. We'll review the rules of IRA rollovers, and we'll offer advice to better your aching back. But until then, please remember to make the most of your golden opportunities.
Would you like to join our kitchen conversation? All you have to do is call toll-free 1-877-765-1543 and leave us your question, name, and phone number. Or log on to www.golden.tv for all the latest information and show updates.